My name's James Anthony. I'm Vice President of UNISON and a nurse working in the health service. And health and safety in the workplace has always been one of the top issues for workers and for union reps. But COVID-19 put it to the top of the media and political agenda as well. For nurses like me, along with other health and care workers, it's been a frightening time as colleagues fell ill around us and too many lost their lives. The anger and frustration was palpable in the NHS, with many staff working under the constant threat of running out of vital PPE. But often partnership working at local and national levels meant that issues were identified and dealt with. But our members in social care and nursing homes fared far worse, too often an afterthought for policymakers, and with a fragmented and privatised system broken long before COVID-19. For Unison, these members are a priority, and together we've achieved improvements in PPE guidelines to reflect what our members on the ground needed based on their experience. We achieved funding to pay social care staff who need to self-isolate, but are still having to fight across a number of employers to make sure this happens. It is vital for care staff, too often on or even below the minimum wage, to be able to afford to isolate to protect their service users. I worked as a care assistant and I can tell you this is highly skilled work, not low skilled like this government call it. But it must be clear for all to see now that we need a national care service with national standards, including improved pay and conditions for staff. It was Unison and other unions that spoke up for our black members as it became clear that they were being disproportionately affected, and union reps locally who are ensuring appropriate risk assessments are carried out and action is taken to protect black staff. Unions organising doesn't only help protect our members, it helps protect our service users too. Research just published shows a 30% reduction in mortality in unionised nursing homes. Think about that. In that study, deaths went down by a third when staff working in the home were unionised. Trade unions literally saving lives. You would not think so, given the way the Westminster government paint unions in education as the enemy that somehow seems to hate children. If anything, it's the confusion and ineptitude of Johnson's government that led to students and parents being understandably worried. It's unions and our members in schools, colleges and universities working to ensure a safe return, but only when it is safe to do so. In tough times, many workers turn to unions. Members have been joining us in droves, but we've been working to ensure they stay with us and get active within the union. And this has meant boosting the number of vital health and safety reps to help us through the pandemic and beyond. And today we're launching our No Going Back to Normal campaign because you clapped us and we thank you. It was a real boost for us in those dark times. But now help us make sure we don't go back to being undervalued public service workers in unsafe workplaces in an unsafe society. Our support and solidarity for each other is the only thing that will get us through this pandemic. Let's build a new society